I'll try to not to spend too long on my presentation. In fact, the title says Guidance to Patients and Consumers on Medication Error Reporting, but what I'm going to speak about is more about the importance of engaging patients and consumers, and that's much more dynamic process than just providing guidance. Well, a lot of you know who European Patient Forum is, but for those who don't, here you can see we're an independent non-governmental umbrella organization. And I think for the purposes of today, it's important to really stress that with our 57, in fact, there's a mistake on the slide. At the moment, we have 57 member organizations, and they are national patients, coalitions, and EU-level disease-specific patient organizations. And they represent an enormous variety, not just in terms of geographic location, but also in terms of disease areas. And our work focuses on cross-cutting issues that are not disease-specific and that are of interest to all patients with chronic conditions. Now, we have seen that medication errors happen in many contexts, and in fact, many more than are listed here. And for us at EPF, we haven't really done a lot of work on medication errors as such, even though we have been involved in a number of patient safety initiatives in the past, and we also were involved closely in the legislative process on the new pharmacovigilance legislation. So I'm going to address the reporting of medication errors as stimulating the patient and consumer reporting of ADRs generally within the new legislation, and then make a few general points that put medication errors and patients in the wider context of patient safety, generally speaking. I don't need to dwell on the benefits of patient reporting because we already know that it adds value and that it is a good tool adding to better medicine safety. But I would like to stress that reporting is also in itself an expression of patient empowerment and a means of developing health literacy and becoming empowered. So it's an important process, and empowerment does enable patients to engage in their healthcare more actively and take on the role of equal partner, and to develop better awareness and knowledge about medicine's use, which is very important when we start talking about preventing medication errors. Some challenges that we at EPF have noted regarding the new pharmacovigilance legislation. First of all, patient communities, as I said, are extremely varied, and also in terms of their level of knowledge concerning pharmacovigilance, concerning EU legislation, concerning medication errors, I would imagine as well. We have a range of levels of knowledge, from purely lay patients to people who are active in the EMA and have extremely sophisticated and detailed knowledge. Last year, EPF developed and published a toolkit on the pharmacovigilance legislation, and the aim of that was to support patients' advocacy in member states. The feedback we have received so far indicates that not only has there not been much engagement of patient groups nationally, but also that there is a need to create much more and much wider awareness of pharmacovigilance and even the basics of what is pharmacovigilance, what are the roles of the European Medicines Agency and the national medicines agencies. And we will undertake, we have seen particular, I mean, this is an indicative, but particular feedback from certain countries, mainly in the Eastern, Central and Eastern Europe, where some of our members have indicated that they may face particular challenges because not only is patient and consumer reporting a new thing, but also patients' involvement in health policy generally in those countries is not very well recognized and developed. So in follow-up to our last year's toolkit, we will do during this year a survey of our membership to gauge their awareness not only of the EU legislation, but also to see whether they have actually been involved nationally in implementing the EU rules. My hunch at the moment is not much. And we will also, based on the outcomes of this workshop, among other things, we will integrate questions around medication errors and see what our members' awareness is around that issue and with relation to the pharmacovigilance system. So how to stimulate patient reporting was the question that I reflected on. And I just want to show this because it shows sort of one example of where we are now. In 2013, the pharmacovigilance legislation is not actually a brand new thing anymore. And yet in some member states, I would suspect more than a few, the patient's role has not really been yet integrated into the communication about it, and the patient has not really been integrated. And I should note that when I say patients, I speak as a patient organization representative, but many of these points I would imagine implicitly apply also to consumers, not necessarily all of them, but please be aware of that. So here you can see a website from an unnamed pharmacovigilance body. It contains a wealth of information on how to report adverse drug reactions. And the patient's role basically is in one paragraph. They are asked to talk to their doctor or pharmacist, who will then fill in the form on their behalf. This is what we would like to get away from. I will present a few potential, what we would consider critical success factors for the successful implementation of the legislation. And I will start with the clarity about what to report, where and how. And on this, Mick Foy already gave very nice information in much more detail. The first point is that there needs to be very clear information about very basic things, about what medication errors are, in what kind of context they can occur, and what the reporting system is for, what its purpose is, and also, as Mick said, as Mick's presentation demonstrated, which bodies are the right ones for different types of reports. And patients also need to have, I think, particularly when it comes to medication errors, reassurance that it's okay to report medication errors or even misuse by health professionals, and that it's okay to report medication errors committed by patients themselves. You know, that they're not going to be then faced with some kind of terrible comeback. And of course, where and to whom patients in their community can turn concerning adverse events or suspected adverse events of any type, or if they have questions about this, there should be some body or some kind of community contact, in our opinion. Information generally about medicines and including about errors should be informative and yet not alarming, because there is always the risk that patients who get alarmed will stop taking their medication, and that is a big risk, and patient organizations can help in communicating these messages. The second factor is accessibility. The different reporting options available, the legislation does specify that there has to be one other option at least, besides internet reporting. We think it would be excellent if there were several, and particularly a telephone, including a telephone helpline, has been mentioned several times as something that would be very welcome by patients. Some have suggested that perhaps patient organizations could even collect forms and forward them to the national authority. That might be a possibility. And I'd also like to stress that it would be important to consider how to reach hard-to-reach groups. For example, older people, people with disabilities, certain minorities and socially disadvantaged groups, and perhaps targeted strategies to inform them about the options available to make sure that everyone in society has a chance to benefit from the system. Then feedback has been widely recognized as a major motivator. And that should include both information about the general purpose and benefits of the patient report, information on how the data provided by the patient will be used, including confidentiality considerations, and further information of where patient could find further information and different sources of information, for example, the adverse reactions website. And many people have requested individual feedback as well from the authority. Then I want to mention awareness and trust. Public awareness is incredibly important, not just of the reporting option and how to do that, but also about basic awareness, as I mentioned, about issues concerned with medicine safety and pharmacovigilance and what it is. And here the role of the media can be quite interesting. They can help disseminate messages widely. On the other hand, the media also can sometimes focus on negative and alarming things, which is not necessarily constructive. So managing media messages is, I think, a challenge. Community health professionals can have a very supportive role for patients. Leaflets, for example, could be available in pharmacies or at primary healthcare centers. And again, patient organizations can support the dissemination of key messages to their patient communities. Trust in the system is something that we could probably discuss for a whole day. It's incredibly important, and I think it would be it's important to consider, you know, do the messages, does the information come from a trusted source, and how, you know, what are the factors that create trust, maintain trust, and maybe re-establish trust. Excuse me. The general point is that public information campaigns should always engage all the stakeholder groups, and that includes patients and consumers. Then, just to continue along the same lines, information for patients. Basically, we feel that effective dissemination is really the key to the successful implementation of this legislation. Patients want the information that they need to be there at the time when they need it. And information to patients about medicines should also take into account the fact that patients are have different levels, different needs, and also different levels of understanding and health literacy. So health literacy principles ought to be considered when developing information. For example, the national medicines web portals will have a lot of information on them, including things like summaries of the risk management plan and the list of products that are subject to additional monitoring. But this needs to be presented in a way that is both understandable and relevant to patients' concerns. Otherwise, patients will not use the resources and they will not benefit from them. And again, I repeat, patient organizations can support these messages and can advise on how they are developed. They can also support awareness in the longer term. Media campaigns can be quite short-lived in their effect, but patient communities stay in contact with their patient organizations, and so patient organization engagement is very good in this regard. And this brings me, in fact, to another key success factor, which is to engage patient organizations in member states. They actually see as their role the promotion of patient safety and the promotion of patient reporting, and they want to be able to address queries from their patient communities. Now, there are already some good materials available. I mentioned here a couple developed by umbrella organizations at the international and EU levels. The EPF toolkit is widely available, but it's, of course, in English only at the moment, and when we update it, we shall look into the possibility of different languages. The international organization, the International Alliance, IAPO, has developed a patient safety toolkit with frequently asked questions and, in fact, checklists for patients on a number of different topics, some of which are taking medicines correctly and what to do if there is a medical error. That will also be updated in the near future and could address the question of medication errors. And I want to mention social media because patient organizations increasingly communicate to very wide audiences through their social media networks. So in order to take on these kind of tasks, patient organizations do need support, possibly capacity building to really get a grip on the issues so they can answer queries from their members. And also, as the directive recommends, the national competent authorities should engage their national or their country's patient organizations and, for example, have meetings with them. Is this happening? I'm not sure to what extent it is. We have not heard very much. I suspect it's not happening a lot. But patient organizations can actually concretely help their national authorities, for example, as I mentioned, by advising how, when, and what to communicate to patients concerning medication errors. And I would also like to say that when there is a recognized risk of medication error and a risk management plan is put in place here at the EMA level, for example, this information should be available to patient organizations so that they can inform their members quickly when there is an issue. I probably need to skip this slide in the interest of time, but I just want to say that to look at the patient-health professional relationship is key when we look at the wider aspect of patient safety and medication errors in that context rather than just in the reporting context. And we do need to build on that and build better skills and attitudes for health professionals to cope with the empowered patient. So in conclusion, a few recommendations for today. Specifically for the member states, EPF does believe that member states should proactively engage patient groups in awareness campaigns and to develop the key messages. This would make sure that the message is relevant to the patients and that it answers the information needs and caters to different needs. And member states should put in place guidelines for the follow-up of reports. And this should be done in consultation with both patients and health professionals. Tools that are chosen should be user-tested as widely as possible. And feedback should be collected not just once, but on an ongoing basis. For example, online through a feedback link. And when auditing the pharmacovigilance systems, which member states are obliged to do this year, they should ask patient organizations for their feedback on the functioning of the reporting system and how to improve it. Appropriate support and capacity building initiatives should be developed for patient organizations on reporting and on medication errors too. Here at the EMA, there are a lot of good resources like EMA training sessions and workshops, which could potentially reach a wider scope and which could address this issue, particularly for the European level organizations that then disseminate the messages down to their national members. That is very useful. And tools like the recently developed video tools have been very, very welcomed. Of course, here we have the issue of language again, because language is a barrier. And at member state level, really, we do believe that specific training sessions on pharmacovigilance for patient groups should be organized at national level in their own language and their own context to equip them to really effectively engage in the process with national authorities and also to field queries from patient and the media, which will inevitably come to them. Finally, two general recommendations. When we talk about reporting and learning systems generally, based on a no-blame philosophy, these systems should include an effective channel for patient involvement, to elicit the patient's experience and observations. This is very important in the wider healthcare context because patients' observations can help improve the system generally, for example, by pointing out areas where there is fragmentation or a lack of communication, and thus indirectly can help prevent medication errors. And EPF would like to see an EU-wide study of the implementation of patient reporting and its impact, including the experiences of patients in different countries and the extent of public awareness. And I think the same could be applied to medication errors specifically. So with that, I would say thank you for your time, and I would be happy to answer any questions.